Morning, everybody. So my name is Daniel Lee. I'm one of the clinical glaucoma fellows here at Wills, and I've been given the task to share with you probably, in my mind, one of the most important things, which is medication compliance or medication adherence. And over the next few minutes, I hope to shed some light on how big of a problem this is, even though it's been touched upon already by several speakers, how it's affecting all of our patients' lives on a daily basis. And hopefully towards the end, I want to empower all of you with a few practical solutions that you can apply to your life today. So we really are living in a very exciting time in glaucoma. There are more treatment options in glaucoma than there ever was before. There are innovations in medications, innovations in surgeries, and even innovations in our diagnostic capabilities. But statistically, glaucoma still continues to top the list as one of the most common causes of blindness worldwide. So there seems to be a disconnect here, where our capabilities to treat it is getting better, but people are still losing vision. So before I move on, I just wanted to share with you a case that I saw in our clinic 2 weeks ago, and it's the story of Miss White. So she was a 62-year-old, very lovely lady who went to see her local eye doctor to get new glasses. After a very thorough exam by her eye doctor, she was told that she had glaucoma, and this is the first time she's ever been told this. In her mind, she was very surprised because she thought of herself as somebody who was very healthy. Besides her having carpal tunnel syndrome, she never had any other medical diagnoses. Her vision was always perfect with glasses, and she never had any pain or discomfort. So obviously, she was quite taken aback by this news. So on that visit, her doctor prescribed her some eye drops that she quickly found out was going to be a big nuisance in her life. Her carpal tunnel syndrome certainly didn't help, and holding the tiny little bottle in her hand was painful. She was having tremors, and she had a very hard time getting a drop into her eye. And when she did get lucky and the drop actually got in, she had a terrible burn in her eyes. So after struggling through this for several weeks, she finally got fed up with the treatment and decided to stop taking her drops and never go back to her eye doctor. So several years passed, and gradually she started to notice that her vision was getting blurry again. We got to a point that she couldn't tolerate it anymore, and she went back to her eye doctor to see if new glasses would possibly make her vision better again. And as you probably could have guessed, her glaucoma got much worse. And after a thorough exam again, the patient was sent directly to the Wills Eye Clinic to get further evaluation. When we did her visual field test, this is what we got. So the darkened areas is the abnormal areas, and the areas that she was not able to see. So quite advanced disease, as you can see. So this truly is a tragic story, and unfortunately this is something that we see far too often. And you know, we'll touch upon some of the factors that cause this. As we now know, glaucoma is a relentless disease, and we have to be equally relentless in our battle against it. But we know, according to the World Health Organization, that in patients with chronic diseases, by the end of the year, about 50% of people will be using their medications as they should. And these numbers come from developed countries. If you look at countries that are developing, these numbers are far worse. And our glaucoma patients are about the same. You know, there are a number of studies that were done, and the range is between 30 and 80% of people who are using their drops properly. So certainly medication adherence is a significant risk factor for vision loss among our patients. Now, the glaucoma community has become quite interested in this subject because we recognize how big of a problem this is. And several studies have sought to look at some of the, to identify some of the barriers that might create these gaps in care. As we know, glaucoma in its early stages is asymptomatic. People usually have great central vision. They don't have pain. So when somebody is diagnosed with glaucoma, it is quite a tough sell to ask somebody to use eye drops every single day for the rest of their lives. And if you add some of these barriers like difficulty instilling the drops, if you have tremor or pain in your hands, if you're forgetful, if you start to have side effects like red eyes and burning, if the cost of treatment becomes prohibitive, it's really easy to understand how the adherence rates are this low. So how can we bridge the gap? How can we get these innovations in our treatment to our patients so that we can prevent vision loss like Ms. White had experienced? So I just want to go over 4 main points here. I think that this is the first point, and probably the most important, is to be informed. So you have to learn about your condition and the treatments. And your glaucoma doctor and the office staff are really your best resources. So come to your visits prepared. So ask questions. When your doctor wants to give you a new eye drop, ask the what, why, when, and how for all of your treatments. Attend the CARES conference and you're here. Thank you for coming. And finally, I would encourage you all to visit the website willsglaucoma.org. Here you'll find many educational resources for patients of all levels of glaucoma. You'll be able to see previous talks from CARE conferences in the past. And also you can get answers to frequently asked questions regarding glaucoma and its treatments. The second solution is to have a game plan. So create a daily regimen for your medications. It's very hard to create new habits, but think of all the habits that you've created already in your life. So for example, we all hopefully brush our teeth twice a day at least, once in the morning and once at night. If you're using a drop that needs to be used twice a day, it's a good idea to use the drops before you brush your teeth or after you brush your teeth. If you have a drop that needs to go in 3 times a day, you have 3 meals a day, so breakfast, lunch, and dinner. So you can certainly link your eye drops with your meals. And for those who are technologically inclined, now there are several applications that are out there that act as a reminder for you to use your drops. And here are just some of the examples. If you go in your app store and you type in glaucoma, you will see a list of applications that will come up. Have a support system. So you don't have to do this alone, as Deb says, and bring a friend or a family member if you can to your visits. Having an extra person there can help remember the details from the visit, and they may have questions that you may not have thought of. So having somebody else there at your visit is always helpful. You can always join a local or online glaucoma support group. And finally, as Deb Robinson did a great talk on her services, meet with a social worker. They can help navigate the healthcare system and really help you work with some of the barriers that you may have in your treatment. And finally, team up with your ophthalmologist. As I said earlier in this talk, there are multiple treatments available out there. And that means there are multiple roads to lead to the same outcome, which is to lower your eye pressure and to treat your glaucoma. So if one way isn't working for you, please speak up. Talk to your doctor. Tell them what the barriers are for you, and maybe we can work together to figure out a treatment plan that works best for you. So we all need to strive for a shared plan and goal. So moving forward, many innovations are being made in the future that will help reduce these gaps in cares. So there are new surgeries that are coming out with improved safety and efficacy. There are improved drug delivery systems, as Dr. Fudenberg will speak on very shortly. However, your active role in your own care is critical to success. They are your eyes. Nobody can take care of them better than you. Thank you very much.